So I'm going to lead you in a guided meditation that I came up with and see how it goes. If you have a very positive reaction to it, then it worked. If you have a very negative reaction to it, then it worked. So we'll see how it is for you. So please close your eyes and just imagine yourself alone in your home, and you're just kind of thinking about things to yourself. And you're focusing a little bit on your body and some things that you've been noticing about your body. And some of those things are you've had a little bit of backaches the last several months, and you've decided to go to a physical therapist who's giving you some exercise to handle those feelings you've been having. And it's had a little bit of an effect, but not very dramatic. So you still work on those physical exercises, and you've recently started taking on the 8 precepts several times a week. And again, the last few months, you've been noticing a bit more stomach aches, and you've kind of attributed maybe this 8 precepts. I don't know, those monks and nuns do that all the time, but it seems to be a little bit harder for me not to eat. You've had stomach aches before, but these seem to be increasing, so you're not sure if those 8 precepts are so good, but you try to investigate. So you go to the health food store and you get different medicines, and you're surprised by how many different medicines there are for digestion. So you buy a bunch, and again, they help a little bit, but not a lot. You've been just wondering, is this just due to kind of my body aging, or I guess it's just sort of normal. You think, this is what happens as people get older. And so you have a time where you're kind of excited to see a friend who you haven't seen in about 4 or 5 months, and this friend's been traveling for a while, and so you have a lunch date, and so you go to see your friend, and you're at a restaurant, and you hug each other, and you're very happy to see each other, and your friend looks at you and says, gosh, it's kind of strange. I think because I haven't seen you in a while, you look different. It's like you're kind of like have a yellow tinge or something. There's some sort of a tone. Actually, it's in your eyes as well. It's like you seem like your whole body and everything. It's just slightly there. I mean, I might be wrong. So you and your friend come up with a plan to look through some old photos, see if you can find anything in the last 6 months where you could compare, and just between the two of you, you see like, oh yeah, there is something a bit different, something a bit changed. You don't make too much of a snap judgment around it. You just sort of, not sure, but I'll just go see my doctor. So you schedule a visit with your primary care physician, and you kind of guess like, I guess I just didn't notice it. If there was a change, it might have been just so small. And you ask some of your other friends and relatives who haven't really remarked or anything, who've seen you more frequently. But then when you tell them, they say, oh, I do see it now. Yeah, there is something there. So you go to see your primary care physician, and she kind of looks you over and starts asking questions, and says, well, I haven't ever heard you talk about this, but yeah, there's definitely this yellow tinge. You ever had anything called Gilbert syndrome? You ever had that in your history? I said, no, never. Never had any elevated bilirubin? No. And he looks over your blood history and times you've had exams and seen there's nothing there. So he says, okay, well, I'm just going to order some typical tests to see what's going on with you. And you ask, well, should I be concerned? And she says, not necessarily. We're just going to see what's going on, see what's happening in the blood. But it could be that you have something called jaundice, and we just want to see why. And there could be various reasons for that. We just want to kind of investigate what the problem could be. So after you have your blood test, you are a bit worried, actually hearing the doctor talk about some sort of physical manifestation of this. But a week passes, and your doctor asks you to come into the office to discuss what was found with your blood work. And you said, there's some anomalies here. It's it's definitely not this Gilbert syndrome we're talking about. This seems to be something new, and so just want to do some investigations here. Nothing to get worried about. Just going to try to see what's going on. So he actually orders an MRI of your abdominal region, and tells you that it'll be about 2 weeks. And you say, 2 weeks? Can I find it earlier than that? I mean, geez, it's a long time to wait. He said, well, we're not really sure what it is, so it's not necessarily a drastic thing, but other people wait sometimes a month or two for MRIs. So 2 weeks hopefully will tell us something. I should get the report soon after that. So you have this MRI and you're waiting, and there's a bit of nervousness. You start doing some research on the internet. What leads to jaundice and what are all these problems? And you start listing all of the possibilities that could be there and going over and trying to figure out all of your symptoms and what it might be. Anywhere from you have like days to live till it's nothing. So you schedule a visit with your doctor, and she sits you down and she says, okay, well, I just want to talk with you about what we found on your MRI. And she asks you to take a breath. Now you're really worried. Take a breath. She's never told me to take a breath. Why did you take a breath? Are you breathing? So yes, I'm breathing. I know how to breathe. I'm a Buddhist. I know how to deal with this stuff. Just what is it? Tell me what's going on. You start feeling impatient. Okay, well, we have found tumors in and around your pancreas. And it haven't left your pancreas, but we're going to have to do some more tests and seeing what's actually happening. But it appears from the MRI that you definitely have pancreatic cancer, and we need to do some further exams about the tumors that are there. And you think, what? Cancer? Like what? That doesn't make any sense. Cancer doesn't run in my family. Are you sure this is right? Maybe you have an MRI from another patient that was confused with me. Can you look at the name? Is the name right? Yeah, this is your name. This is your MRI. This is your body here. I don't think so, you say. That doesn't make sense. I've been healthy for years. I've never had major illness or anything like that. Nothing really affected me that much. I mean, cancer, what stage? I mean, can you tell? Well, we can't quite tell, but it's between stage 2 and 3. 2 or 3. Well, look, I don't really know about pain. Isn't it like 4? Isn't that the last stage? And your doctor says, yeah, that's the last stage is 4. Oh, well, what now? And she says, well, now I'm going to refer you to a specialist in pancreatic cancers and other cancers of the abdomen, and we will see what that doctor says. And they're going to probably do some further exams and see what's actually going on with the tissue. So your doctor is very kind and suggests, if you want to see a therapist or you want to see somebody, so I'm fine. I can deal with this. And you kind of walk out thinking, I still think they got me confused with someone else. It just doesn't make sense. Either way, I'll just, if I do have cancer, I'm just going to take the medicine and deal with it, and I'll be fine. So you do go to this cancer specialist, deals with different cancers of the digestive tract, mostly focused on pancreatic cancer and liver cancer. And he tells you he's going to run some tests. And so they need to get an exam. They have to actually test the tissue out. And so they arrange for this. And during that time, it's very hard to sleep. And you're quite worried. And you notice that any spare time you have, you're just looking it up on the internet. What is stage 2 pancreatic cancer, and what's the survivability rate, and stage 3, and so you're kind of getting very nervous and talking to family and friends. And it's already been 2 months since you started this investigation, and you're thinking, well, geez, this is just a lot of time that's being wasted. So you have more exams, and the doctor comes back with further reports. Your new doctor asks you to come in and says to you, okay, well, we have further evidence of what's going on. So this is not a benign cancer. These tumors are spreading. They haven't quite gone out, but we are seeing signs that they're moving out of your pancreas, and your pancreas is quite damaged, which is showing why you have such elevated levels of bilirubin and jaundice. And even since I last saw you, the yellowing of your skin and your pupils and your eyes has increased. So I'm going to run further tests, but I'd like you to consider now that chemotherapy is next. And my goodness, this is kind of a bit too much for you. I'm thinking, chemo, like, I didn't think I'd ever have to be on chemo. This is just too much. This is ridiculous. Your doctor explains that there's, this, you ask him what should you do and what's going on. And he says, well, at this stage and what's going on, most people would start with chemo, put you on a chemo regimen called gemcitabine, and that has a lot less side effects for you, but your hair will likely fall out and you will experience some nausea. But I can give you certain medicine that will help you with that. And with your hair, you'll probably have to go out and look for a wig. And you think, oh, well, I guess I should just go to the monastery and learn how to shave my head. This just sucks. And so you're pretty upset, and your doctor sees that and sees that you're getting not only agitated but angry with the situation, and suggests that there are ways of alleviating this. And you remind yourself, right? I'm a practitioner. Like I can kind of try to work with this with the mind. And although you've been trying lately to do that, it's been difficult. You find that your mind has been very distracted, and it's been very hard to deal with this, because you say to yourself, it keeps getting worse. It's like, I'm not getting any good news. And you asked your doctor, well, what's the survivability rate? And he says, well, it's just different for each patient, and it's very hard to say. And you just say to him, look, I don't want to, if you don't tell me this, I'm just going to look it up on the internet. So you might as well just say it straight. Like, what is going to happen to me, or what is your best prognosis? What's going on? Because I know you've seen other patients like me. I know you've had other people who've done this. He said, well, some people do have different reactions. Some people survive this, but well, the fact is that 90% of people who are diagnosed with stage 3, they usually have passed on within a year. You start counting on your fingers. It's been 4 months. Wow, I can't believe I'm hearing this. But it's not necessarily the case for everyone. In rare cases, people do survive this beyond the year. And you ask for how long? Well, at this stage and with metastasizing, maybe 5 years could be the most. So you agree with your doctor to have the chemotherapy, and you leave the office with a scheduled regimen for when that's going to take place and when you're going to return. He mentions that there'll also be what's called external beam radiation that will be in conjunction with chemo. And unfortunately, your tumors are located in a place that makes it impossible to extricate them through surgery, which you find out later reduces your chance of surviving. Many of your friends are comforting you and talking with you and your family, and you're, of course, talking to them and looking for support. But after a while, you kind of notice as the months go by, having your chemo and dealing with your body, that the people who are staying around you and with you, there's just sort of a small, close group of friends and family that are actually seem to be calling you and talking. And a lot of your other friends who aren't part of this small circle, they've sort of faded in the background. They stopped calling, and it seems like they're not interested, or maybe they just don't want to hear. They're just kind of going on with their lives. You've worked through a lot of your anger through this, and you're having to deal with the chemo treatments and the radiation, so you're becoming more tired. but you're trying to deal with it. You're again continuing to look at the internet and figuring what you can do about things and see if you can try different medicines and try different options. And the next visit to your doctor, it's not good news. He tells you that despite the chemo and aggressive radiation, the tumors have metastasized through your abdomen, into your liver, into a small area of your lungs as well. This brings you to a lot of sadness. It's like you feel there's no way out. There's nothing you can do. And all the while you're trying your practice, you're trying to keep up, you're trying to really bring yourself back into the body, but it's so hard. And you realize death is coming. You keep telling yourself it's not fair, like I thought I'd have some control. I thought I'd be able to do something about this, and it's not working. And so you sink into a bit of a depression. The doctor continues to treat you with radiation and chemo just to keep the time more open, to reduce the amount of tumor spread in such a short time. But you're feeling sick from these medicines, and you go to your doctor and ask if it would be okay to stop. And he says, of course, it's up to you what you'd like to do. So you decide to go off of the chemo and the radiation, and you know that this will possibly speed up the progress of the cancer. And so he asks you if you'd like to sign up for hospice, and you agree. You say, yeah, I think there's nothing else left to do. That seems like the right thing to do. And there's a sort of resignation that's occurring. There's a sense of, I don't think I'm going to beat this. When you count, and it's been 9 months now since you first discovered this. And you're practicing all the while, and you're finding more and more that there is a sense of forgiveness for yourself, a sense of metta you have that you hadn't discovered was there. And one of the interesting things that you're finding is, as you're more and more accepting of this experience and what is inevitable to come, you're also feeling more compassion for others, even those people who have hurt you in your life and who have been problematic. You're seeing a lot of pettiness that has occurred in your life, and you wish to let go of that. You start spending more and more time practicing and paying attention to your body, but sometimes you're frustrated because you realize, I just never thought that this would happen like this and so fast, and I just wish I had put so much more time into my practice. But this is what I have now, you tell yourself. As another month goes by, you see that you're less interested in eating so much, and your meals begin smaller and smaller, and your interest in socializing and being with others also begins to wane. And you appreciate the visits from your hospice nurse, and he's very kind to you. But more and more you're just wanting solitude, and you're tending to go more and more inward. And you're noticing through this time that your body is becoming weaker, and it's becoming more difficult to get up and walk, more difficult to move. But you're using this to understand your body's end. And there are glimpses at times of the Buddha's teaching on impermanence that you really recognize. And you start to see that you have some insights around his teaching of not self, that you kept attributing so much to this body. And although these insights are helping you, there's still fear of what's coming, but you're being more aware of that fear. And in a sense, you're making friends with it because you can't chase it away. Eventually you stop eating completely, and also the amount of liquid that you're taking in is very small. And you overhear your hospice nurse speaking to your other family members and friends who are asking questions, and you hear the words, "It could be days now." And more the feeling of going inward is present for you. The desire not to really speak to others. And you're sleeping more. Sometimes you'll wake up and several hours will have passed. You're dealing with a lot of tiredness. And your body has lost a lot of weight. There's a mirror that's been around, and occasionally when you turn to it, you see that you're quite yellow, and your skin is just very yellow at this point. But even though your body is so thin, there seems to be this fluid buildup that's occurring, and you're watching this. You're watching this now with a much more impersonal experience. And the hospice nurse, as well as your family members, are giving you medicine because you're dealing with certain nausea and bloating, and there's a little bit of confusion. But you're focusing as much as you can in your awareness. You're relying on that more and more than anything else. But your experience of being conscious is fading. To the point where you no longer open your eyes. You can still hear things, but they don't seem very important to you. Just this awareness, this presentness of present with your own experience is there. Even through the confusion, sometimes not knowing where you are, sometimes not knowing who you are. And at last, as things are just about to really disappear in your experience, there's one last thought trickles through your consciousness. It really never was mine to begin with. And you pass on.